I'm going to take us back to high school biology class when we learned about our cells and the mitochondria, which is the powerhouse of the cell. That is where we create energy in the form of ATP to power all the processes we use each cell for. Well, we make ATP from NAD. And NAD plus has become all the rage on social media, and that's because it does a lot of very important things for our cells. We make NAD from niacin or vitamin B3. There are a few other precursors down the line that are supplements available to take to boost NAD levels. And then there's also NAD injections, NAD infusions. There are other sublingual tablets and nasal sprays that can be used, but we often see the best results from NAD injections or the infusions. The infusions are fantastic for somebody who's having severe fatigue, brain fog, long COVID symptoms, autoimmune conditions, neurodegenerative disorders, but they take a little bit of time to infuse. If we give NAD infusions a little too quickly, it can be uncomfortable, but typically the infusions take about 2 to 4 hours, and we do that here in our office. And most of us don't have a lot of time to spend like that for an infusion, but if your symptoms are bad enough, it's well worth the extra time that it takes to do the infusion. Most of our patients typically come in once a week to once every 2 weeks for the infusion, and then we can supplement with NAD injections in the meantime. We typically recommend about a once a week in the muscle injection. If I had somebody who had significant symptoms and couldn't come do an IV, then we might try an injection 2, 3 times a week to help with the symptoms. So some of the things that we recommend our patients try to boost their NAD levels include any type of fatigue, memory fog or concentration issues. It can help with mood issues like anxiety or depression. It is fantastic for helping to calm inflammation and pain. It also helps with things like migraine headaches, and it's been shown to help improve DNA repair. So there's a lot of different things that we might choose to recommend boosting someone's NAD levels for.